This podcast is produced by the Center for Deployment Psychology at the Uniformed Services University of the Health Sciences. The views expressed are those of the speakers and do not necessarily reflect the opinions of the Uniformed Services University, the Department of Defense, or the U.S. government. In addition, references to any specific companies, products, processes, or services does not necessarily constitute or imply endorsement by the Uniformed Services University, the Department of Defense, or the U.S. government. Welcome to CDP's podcast, Practical for Your Practice,
where we give you actionable intel to support what you do.
One colleague to another.
Hello, everyone, and welcome to Practical for Your Practice. Andy Santinello here, and this is actually our final episode of Season 3.
We've made it.
We made it. So thank you for taking the journey with us. We hope that you've enjoyed the topics for this season. We can't wait for season 4, but this is our last episode for a little while, so it's bittersweet. And you've already heard Kevin. Kevin's with me today. Hello.
Hi, everybody.
How you doing today, Kevin?
I'm hanging in there. How are you?
Good. How are you feeling about this being our last episode for a little while?
It feels like an accomplishment, really. Like, I will say, when we first started kicking around ideas for the podcast, the idea was, we just kind of hang out and talk like colleagues. In fact, I think it was that you and Jenna and I were having a conversation one day, and we're like, why aren't we recording this? Why aren't we like letting the whole world listen to us just talk? And there was a certain level of arrogance there that anybody would care about our conversations. But I think in some ways, we've had some really very cool conversations. We'll have another one today, and so it feels a bit of like an accomplishment that, the podcast has lasted this long, and we're looking forward to a season 4.
I'm going to reframe, since we're going to be talking about thoughts today, and reframing is maybe a technique. I like to reframe it as, we were having a good time chatting with each other and geeking out, and we just wanted to let other people, if they chose to, join the party.
I think that's a great reframe.
Thank you. Speaking of reframes and great reframes, we are really excited to have a fellow CDPer with us today, Dr. Jeff Mann.
Hey, Andy, how's it going? Kevin, really, thank you guys for having me here. I'm looking forward to this.
So, Jeff, you and I did basically what we're going to do today. We did a podcast even before there was a podcast. You remember that early on?
Yeah, we're talking about telehealth and all that fun stuff in the pandemic, right? And oh my God, it's that feels like both 5 years ago and yesterday all at the same time.
Right.
That time has been distorted.
Yeah. Yes. Hashtag COVID time. Right. So, yes. I don't know what to make of the fact that it's taken us 3 seasons to invite it to, maybe.
Like I said, you guys, I'm going to go under the assumption that you guys wanted to make sure that you really got things professional before you brought me on board, right?
Work out the bugs.
Yeah, exactly. You're like, can we bring Jeff on yet? No. Podcast isn't good enough yet.
Yeah.
I think we could also make an argument that Jeff, you're our first repeat guest. I mean, if we're still counting that COVID podcast, because we said for a number of our guests, we're like, hey, you're really great. We're going to have you back on. And we haven't had people back on yet, not because they aren't great. They really are. But we also have so many other great people we want to have on the podcast. So Jeff, you're our first repeat kind of. Yeah. So
now I am honored.
Yeah.
So can you tell our listeners a bit about who you are and what you do for the center?
Yeah, absolutely. So psychologist, right? I think would be the first adjective that I use to describe myself. I've been with the CDP for almost 10 years now. And prior to that, spent some time in the United States Air Force. I did my internship and kind of first tour there with them. So that's kind of how I got into the military process. Kind of doing my reverse biology. And before that, though, I was working in the IT industry. I was a data analyst. I did my undergrad training in computer science and those sorts of things. So thinking about systems and problems and those sorts of things has always been a big part of who I am. And, it's funny, people would always say, well, you went to such a different field. And I was like, actually not. I'm just solving problems, right? At the end of the day, I'm solving problems. I'm using different tools, right? That's what I was doing before. I was simply solving problems. And now I'm using a slightly different medium with which to solve problems.
Jeff, that's a kind of an unexpected overlap a little bit. I actually started as a computer science major in undergrad, and I switched to psychology probably about halfway through. So I was a psychology major when I graduated. Yeah, and it's funny. Like I always get the question, like, how did you get from computer science to psychology? Like, what makes that connection? So I'm going to ask you the same question because I keep getting asked that. Like, how did you make that transition?
Well, for me, it was actually, I mean, I was working in the industry for about 6 years.
Yeah.
And, it was the year 2000 was a thing. I don't know if you guys remember that. I really date myself with some of my friends and my friends' children. And I'm like, oh, you remember Y2K? And they're like, I was born in 2003. And I'm like, oh, wow. Like that's, yeah. So I was working in that industry for quite some time. But I just I was good at it. I found it interesting, but I was very unfulfilled. I was looking up the chain at the things that I could do, and I did not want to do any of it. Right. And so I really started down this journey of trying to figure out what it is that I wanted to do. And I remember there was this, have you ever heard of the book, What Color is Your Parachute? I want to say it's like this career planning book or whatever it is.
Haven't heard of it.
And there was just this line in there that was just if you find yourself endlessly fascinated about this process, maybe you should think about psychology. And I was like, it was like this light bulb moment for me, because I never took any undergraduate classes. I was all science-based. I was going to be an engineer. I had my double major was in mathematics. I was thinking about working for the NSA and doing cryptology and all that kind of stuff.
Yeah.
And so, but I was unhappy. And so I found psychology. And once I kind of took that leap, I never turned back. I can't say I've never regretted it, but for the most part, I've never regretted it.
We absolutely need to do an episode on origin stories.
Yes.
Yeah.
Oh yeah.
I'll give you a little piece of my origin story, and then I think we should probably get to our topic for today, because this is going to wind up being 17. This could be like season 4 if we just keep going.
Right.
I like it.
So part of my origin story, worked in a fish market, worked in the seafood market. And that really, really helped me eventually when I was working at an OCD specialty clinic, and we had to do all sorts of exposures to gross things.
Yeah, I was going to say,
almost nothing
environment. Yeah.
Nothing grosses me out anymore after being in the fish market.
That's exposure therapy right there.
Yeah,
right?
Exactly. So you never know. You never know what those previous life experiences that are in your reinforcement history will help you to do later on. So Jeff, you wrote me an email on February 10th. And in that email, you asked, hey, I wanted to reconnect and get and love to get your perspective on ACT and the concept of thought challenging. And so I wrote back and I said, this is a good podcast topic.
Yes. And then refused to talk to me ever since then, because he wanted to save it all for this.
Well, I did send you a ridiculously long email about RFT.
Yes.
And that, so just to be fair, and then I've been ignoring you since then. So I'm really curious about kind of your kind of motivation and interest in that particular question. So can you say just a little bit about that?
I think one of the first things is I've just been, I think, I still feel like I'm fairly new to this industry, right? Even though I've been doing it for a little over a decade now, but you see kind of these trends, right? And these waves and processes. And the latest wave, it's I see everybody wants, because the role that I have in the CDP, I work with the military and I help them coordinate their trainings, and everybody wants ACT, right? And you have recently developed the ACT training for the center. And every time I talk to people, they're like, when and how can I get into the ACT training, right? And so ACT has really become this there's this fever pitch of desire for it, right? Even in my private practice, I get patients, inquiring, do you do ACT? Are you an ACT therapist? All this kind of stuff. And so I was really I've really been looking into it, but I think a big part of it is trying to understand where it fits, right, in the world. I think what I've found with ACT is it's definitely a very new set of terms and semantics, right, and those sorts of things. And so my general philosophy is that there's no such thing as an ACT problem or a CBT problem or a psychodynamic problem or, or anything along those lines, right? That there are like we have different ways of getting at, kind of the same mechanism. And so I really started thinking about this because I think there's a lot of things about ACT that I really, really enjoy, especially the values-based piece associated with it, because I really started to integrate that. And I started seeing that in a lot of different places. I did an interview with Tom Horvath, who is one of the founders of Smart Recovery. And he really integrates a lot of values-based work in his focus of, in the smart recovery groups that he does. And that's a big part of the overall process. And so I was starting to see, it's like, okay, like, where is this fitting in and how does it fit into the larger picture? And that's where I really started thinking about, let's see, like, because thought challenging for me, at least thought, now I really even like to play with the semantics, right? I don't even like to call it thought challenging anymore. I like to call it thought analysis, right? We're gonna examine, or thought examination, and
but
those sorts of things.
Even just the language around it has changed. So I think it's sort of your thinking about and sort of evolution of thinking about even just how you deal with problematic thoughts really kind of mirrors a much larger trend that's happening in the field towards process-based therapy. And
yes.
Just a few years ago, Stefan Hoffman, who has been sort of like he's one of the most world famous proponents of sort of traditional CBT, and Steve Hayes, as you know, the godfather of ACT, really started a dialogue between the two of them about, like, how is this really left Twix and right Twix? Are we doing different things? And out of that came this new sort of field of process-based. Originally, it was called process-based CBT, and they're moving to just process-based therapy. But you hit the nail on the head. There are all of these sort of common processes that probably good therapy is tapping into, and the different technologies. And ACT, for example, is just an application of relational frame theory and contextual behavioral science. And it's a form of process-based therapy if you want to use that lens. But there's other types of process-based therapy, so you can do a traditional CBT model from that approach in a more flexible way. And there might be different ways of getting at and working with some of the different elements. And one of the elements that is sort of a common target area process in process-based therapy is cognition.
Yeah, right. Like that is, and that's one of the things that I've always really been trying to focus on more and more. Is this, and because I've even really embraced behaviorism as well too, right? I mean, my kind of journey was like I was super into like existential psychotherapy, existential theory, like in grad school, right? And I still love like existential theory, but I found
there's your values and motivation right there, and actually like motivation / values in process-based therapy is another really critical domain that is often important, when working with clients. So sorry for.
Yeah, no. And I've just found myself, but I guess I would, if I really wanted to describe myself from a theoretical orientation, if I'm thinking about it, it's like, I'm a pragmatist. I'm like, what works? Right. And that's why it's like, now it's like, what, when I started, especially when I started doing like some OCD type of work and that sort of thing, I was like, that's behaviorism stuff, right? Like, and exposure, like this is like, we could talk about this stuff all day long, but it's not going to come anywhere close to like, doing this sort of thing and thinking about, behavioral activation with depression. And there's all these different tools that I think really help us. Rather than getting kind of locked into, it's like either I have to, this one theoretical orientation. And I guess some might describe it as eclecticism. And I don't know, how do you feel like process-based therapy kind of captures that notion of eclecticism? Is it maybe a better better way of looking at it? Because I know sometimes that's been derided by evidence-based proponents, right?
I mean, this is a really critical question that you're asking. And so here's sort of my perspective on it, but I also think this is a pretty good reflection of what the current science is suggesting. And so when I think about normally when I hear a clinician say I'm eclectic, to me, what I immediately assume they mean is they're technically eclectic. Like they're using different techniques and cobbling them together in a way that makes sense to them. But often, when you talk to somebody who says they're eclectic and you ask them about their approach to therapy, they'll just tell you about the techniques they like, but there won't be sort of a really clear underlying sense of which processes they think are important. Their conceptualization skills may not be, they don't have a working model. And so I think what process-based therapy, so then you have folks who are sort of on the other side of things where they are very much, interested and work from a particular model, but that model may not actually be science-based.
Right.
It might just be more like a philosophy, which, philosophy is great. We all have a philosophy. It's a stance we take towards understanding whatever it is we're looking at. It's pre-scientific. So you can't really argue that one philosophy is better than another. It's just where you stand from.
Yeah. And it's kind of like, well, science grows from philosophy, right? Well, we start with philosophy and then we move towards.
And in fact, there are different philosophies of science as well. So there's like a mechanistic philosophy, which is what, most science-based endeavors are based on. And then there's functional contextualism, which ACT is based on. So the question you asked though about, what's the difference between being eclectic and maybe being process-based is that being a process-based therapist, from my perspective, and I think this is pretty in line with what process-based therapists and researchers would say, is we're choosing to focus on processes that have been shown scientifically to be really important in maintaining psychological distress and functioning. And also when you can sort of focus on shifting those processes, they tend to result in good outcomes, both in terms of specific maybe symptom presentations or diagnoses, but more importantly, when people start to behave in these particular ways, they start to live lives that have more connection to purpose and meaning, and they're suffering less.
Yeah. And that really makes me, recall a supervisor that I had, he would, the phrase that he would always use, he's like, you got to think about process, not content, right? Like you need to think about, yes, the content is interesting, but it's not the thing. Right. And that even makes me, one of my phrases, and Andy, I know you are a Zen Buddhist practitioner and teacher and all those sorts of things. And maybe you can help me with the etiology of this, right? But the concept of the finger pointing at the moon, right?
Yeah.
It's kind of like, let's not mistake the finger pointing at the moon for the moon sort of thing. And I think sometimes we get focused on content, right? And see that as the moon, when really it's like, no, the process is really what we're trying to understand and get at.
Well, I won't get into the weeds about Zen. I got into the weeds about Zen a little bit on our spirituality episode.
I was listening to that a little bit as I was prepping for this. I wanted to make sure what I was getting myself into.
But I'll say one thing about that and then relate it back to what you were saying about process and really just kind of bring it down to a clinical example. So in Zen, when I'm working with my Zen students, often people will come with, I want to be enlightened or I want to be calm and really the thing I really very quickly try to get them to let go of is outcome and really focus on, are you doing your Zazen every day? Are you meditating every day? Tell me about like what time of day you're doing it. Are you getting on the cushion every day? It's all about the practice.
Yep.
And I think very similarly, we can get really, especially if you are a consumer of evidence-based psychotherapy, you can get very much sort of focused on outcomes and really forget about the most important thing is what you do in the room as a therapist. So focusing on, and not only that, but are you doing things in the therapy room in a way that is aligned with processes that are going to help your client move towards a life of less suffering? And are you doing these things in a way that are going to help them then do similar things outside of therapy? So if a client comes back, for example, after a week and says, hey, I've been feeling much better this week. It's not that I don't care about that. I care about that. And I'll say that's great. But what I'm really curious about is like, have you been doing anything differently this week that might have led to that? And so if the answer is, well, actually, no, I just, I'm on vacation this week, or
or nothing bad happened this
or nothing
week, right?
bad happened.
They
right.
externalize it, right? I mean, in other words, I am at the behest of the winds of my life sort of thing, rather than having any sort of kind of agency.
Like versus like, we talked about a lot about, working with these unhelpful thoughts I have, and I've been trying, this technique that we worked on, and I've noticed that those thoughts haven't been impacting me as much, and they're feeling better. To me, and even the person came back and said, I've been practicing this thing and I'm getting better at practicing it. And I still have all this stress in my life and I'm not feeling differently, but I'm acting differently. And that just sense of, I feel like this is moving in the right direction, to me is going to be a better sign process wise. And ultimately,
and that's where like my existential heart has really kind of grasped on to some of the principles of ACT, right? Where it's kind of like this. And I guess I want to even hopefully take it's not too far down a rabbit hole, but even this idea of reducing suffering at some level, I think I was reading in one of Yalom's books, right, and talking about existentialism, is that sometimes the outcome of therapy is not necessarily less suffering and pain, right? It is actually acknowledgement and acceptance of it, right? We don't get rid of it. There's greater like awareness of those sorts of things. And so I think, I really like this, and again, functional analysis, I think, is another one that really kind of, I see like I was like, oh, let's really understand the function of kind of what this thing is doing for you, right? And I feel like there's a big part of that, in the ACT, like you're saying, the theory that it's based on. But this way of kind of getting away from the outcome and altering the did I make you happy in therapy, or did I help give you a way to move through the world that helps you feel more in control, more centered, more powerful, right? Like those sorts of things. Anyway,
it's like the proverbial, very cliched, you give a man a fish, he can eat for that day. You teach a man to fish, they can eat his whole life. I don't know what the connection. I've mentioned fish and fish.
I was going to say the connection is back to your fish market.
Coming back to fish and OCD and exposure therapy. Yeah. Well, and I guess, the question I would have, Andy, as we're kind of talking about this, kind of, I guess, at least coming back to my thoughts, it's like, let's talk about this idea of what started as thought challenging to what I like to call thought analysis or thought examination, right? And I don't know, how do you think that, does it fit in to ACT? Because my experience has been, right, and this is kind of maybe my evolution, that it's been really necessary to have some form of framework to kind of put a container for the mental processes that we experience, right? And because if we don't have a way of describing it in a way that myself and the other person that I'm working with can both agree on, then we have a really hard time communicating back and forth about that process.
Well, so here's what I'd say. I'm trying to figure out which question to answer first. There's a couple of good things in there. I mean, on the one hand, I would say, from if I'm going to be in more of an ACT perspective, like even before we get to structure and things like analysis, what I'm going to be very curious about and help my clients to be curious about is developing awareness. First of all, like, just, can you notice that you're having thoughts? And also notice maybe there are certain thoughts that you get more entangled with. And how well are you able to get distance from your thoughts to see, like, there's a you and then there's a thought that you're having. And then we can start to talk about what are you doing with those thoughts? And one of those things might actually already be analysis, and that may work or may not work depending on the context. So, one of the problems a lot of people get stuck with is they notice they're having unhelpful thoughts. They notice they're having unhelpful feelings. And then they start to ask a very reasonable question, which is why? Why am I feeling this way? And then that's just sort of the hook that, drags you down into rumination. I'm feeling nervous about what's going to happen in the future. What might happen? What if? And then that's the hook that sort of, so like analysis, prediction in certain circumstances works and doesn't in others. And so like one of the things I think about these days is really, and I try to help clients see is, first of all, can you notice what thoughts are happening? Can you notice what your responses are? And let's like really walk that out through time and see whether or not it makes sense to do that from a logical perspective. Is this actually working to reduce your suffering? Are you getting any useful, actionable intel about what to do next? So I hold analysis or really any mental process lightly, and it's always going to be about what's working for the client.
Well, and if I can think about trying to distill in overly simplistic terms what I'm hearing, and so it almost seems like from, let's say, just a CBT perspective, the approach seems to be like, look, if we can identify your unhelpful thoughts, your dysfunctional thoughts, and challenge them and help you form more functional thoughts, then suffering dissipates. And what I've learned, I'm certainly new to ACT as well. And what I think I understand from ACT is like you just said, let's start off just, do you even know you're having thoughts? And it's not just, can we find the thoughts that are, problematic and causing you these things, but more about, let's be curious about how do you even respond to those thoughts? Right.
Yeah.
Like on the one hand, from a CBT perspective, the response seems to be like, we need to categorize them as, useful or not useful or functional or dysfunctional. And then we need to work on the ones that are dysfunctional. But instead, from an ACT point of view, it almost seems like it's just like, look, we're having thoughts, and, it's not so much about the content of the thought and there's certainly not a good or bad thought. It's like, what do you do with them? How do you respond to them? And it's not that a thought is good or bad or necessarily functional or dysfunctional, but is it consistent with your values? Is it not? How do you respond to that thought? Did I capture it, or is that?
You did. Okay. And one thing I would like to add to that is useful versus not useful, I think, from a cognitive therapy perspective, traditionally speaking. And I don't want to make a caricature of these two people.
Right. I agree.
Traditionally speaking, I think that the judgment about useful, not useful is based on content of the thought. Mm-hmm. From more of an ACT perspective, process-based perspective is useful versus not useful. Does engaging with that thought work or not work based on the outcome you get from that particular action? So I want to say something about content for a minute, because it seems logical that if you have thoughts that have like a negative valence to them, the content wise, that if you replace them with more positive thoughts, then it's going to lead to better outcomes for somebody. But you can also have a problem where, so if you're familiar with the self-esteem literature, used to be that the idea was that, you really needed to teach kids to have really positive thoughts about themselves all of the time. Mm-hmm. And that was going to lead to better outcomes. And so if you know about the outcomes of those efforts, it actually wound up creating like these little narcissists who have these very fragile egos.
Right.
And so even like really over attachment to positive thoughts, quote unquote, can be just as dysfunctional. So,
and I think, to be fair, not always in CBT is it like we replace the negative valence thoughts with positive valence, but in some ways, and maybe this is where a lot of my training has been so convoluted. I've had ACT therapy oriented supervisors and mentors, and CBT, very CBT oriented ones. But, I would even say that, just to be fair, from some of these CBT oriented folks, they would say we're not trying to replace negative valence thoughts with positive ones, but more of, can we balance it a little bit? Can we, instead of focusing only on negative, can we have an acknowledgement of both sides of it? Or even, can we hold less tightly to the negative ones and allow for the possibility of, that more balance too? And that's where I start to feel like we're, get a little bit of some blurry boundaries here between what we might even think about as traditional CBT versus more of these process-based.
Yeah. And I think the way that I really have approached that is, when I was early in my therapeutic years, that's really what I thought, right? At CBT is we replace, positive thoughts with negative thoughts. And really what I've evolved to is kind of this idea of, no, we kind of right size it. What we do is we acknowledge the reality of one's emotional experience, right? And shift things in the beginning from, I am a failure to right now I feel like a failure. Right. And even helping them see that there's a big difference between those two, that one is the reality of what they're telling themselves, right? This is permanent, this is forever, versus saying, this is how I feel right now, right? This is my experience right here in this moment, right? And getting to that place of being able to say, okay, that's how you're feeling in the moment. That's okay. There's nothing wrong with that, right? So let's talk about where we're going to go from there. And that's really where I've evolved to from kind of like a thought analysis or thought challenging process. Is not to say we're going to replace, because I just felt like it never worked. Right. Like it just never really worked for me.
That is sort of one of the main predictions that, research has borne out with RFT. You can't really delete thoughts from your mind. And it's very consistent with what we know about just from behavioral psychology. You can't really delete behavior from repertoires.
Right.
So the example I always give of that with my clients is I'll ask, usually I work with mostly adult clients, when is the last time that crawling on the floor was your main way of getting around?
Yeah. And
they'll laugh and they'll say, and I'll say, but probably there was a time in your life that was the primary way that you used to crawl, get around. And then, if the circumstances presented themselves, could you pretty easily start to crawl around again? Most people can realize, like thinking works the same way, just because once ways of thinking kind of get in there, all it takes is the right cue to bring those thoughts back out. So even if you elaborate the network, you can't ever eliminate, something from it.
And as you talk about that, it really makes me thought I was having earlier, developmentally, right? Is that, we learn to walk and run and do some really amazing things, right? But oftentimes the way that our metacognition, the way that we think about thinking, it just grows. It grows in an unstructured, undiscussed, unarticulated way, right? And that's where I really think that early level of framework is helping people develop an intentional form of metacognition, right? Like a way that they choose rather than, well, this is just how I've done it since I was 6 years old, sort of thing, right? And I've never talked about it with anybody else, right? And so that's a way, and that's what I think about is it's like, okay, we got to kind of develop some form of way that we're going to think about thinking, right? Some form of way of understanding it, bringing it to a level, like you were saying, awareness, right? Bringing it to a level of consciousness. And so that's what I'm always wrestling with is like, what's a useful way to do that? And I don't really care if it's psychodynamic or ACT or CBT or, Sesame Street, right? Like I said, I like to see myself as kind of like an agnostic in that perspective. So
here's a question about that. So, all right. So if maybe the common ground here, and you can use the word the term metacognitive awareness, if we thought about how we might work with an unhelpful thought from different perspectives. How might you, so from a CBT perspective, like a traditional CBT perspective, and I'm putting you on the spot here. So.
I was going to say, first, you're assuming that I adhere to CBT.
Well, I mean, like for example, like a thought record.
Yes, absolutely. Right.
If you sort of look at it through the lens of developing maybe more metacognitive awareness, a way of thinking about thinking, how might that be similar to, for example, an ACT, helping someone sort of when they notice an unhelpful thought, say, I am having the thought that.
Right.
Like, if you were to,
I mean, for me, I see it as a way, it's like, I don't really see them as different. I see one as writing it down. Right. Is that, and what I like about that is this process of externalization,
perspective taking. It's
yeah,
very
it's
much
very
perspective
important,
taking.
right? And I think in that early phase, they need a way to externalize, right? Whether that's saying it out loud to me, whether that's writing it down, right? And I really, kind of go into this idea. It's just like you were saying before about learning to crawl versus walk and run, right? Like we have to start with a rudimentary way to do it. And I think doing a lot of these activities mentally early on is very difficult for individuals, right? And they need some sort of mechanism to kind of get it out outside of themselves. And if it's only in therapy, well, that's just 1 hour a week, right?
Mm-hmm.
And that's why, well, if they're willing to do some journaling or something, right? And so I look a lot of this not as like, oh, we have to do it this way. I look at it as an externalizing, perspective taking mechanism. Is that kind of, I don't know.
Well, yeah, and externalizing perspective taking mechanism. And
Yes.
there's all sorts of ways that you can train that. Like
Yes.
if that's the process, you're gonna
exactly that is the
all
process.
sorts of ways. All sorts like drills in a soccer practice. You can think of all sorts of ways of shaping that particular process. And so
that is the analogy that I use. With concept, have you ever done a sport, played an instrument, like anything? Most people have done something like that. And I'm like, did you ever practice? And I'm like, yeah. And I'm like, why'd you, we got to go through, why'd you practice? And really helping them see, like, and really, I like to give them confidence because it says, no, doesn't matter if you've never been good at this, right? My belief, and I love like the Malcolm Gladwell. Well, that's not Malcolm Gladwell. I forget who the original author of the 10,000 Hours is. I think Malcolm Gladwell, wrote it. But the 10,000 Hours research is really about the concept of intentional practice is how one becomes good at something, right? Not accidental practice, not just time spent with somebody, but no, intentional practice at getting good at something. And that's where I think this idea of externalization and perspective taking is something that anybody can practice and get good at.
Yep.
And so the question is, well, what, like you were saying, there's 100 different ways to do that, and what's going to work within that individual's life and framework.
This is, I think, exactly like for this right here is, I think, the main distinction and like another answer to the question you asked earlier, which is what's the difference between being an eclectic therapist who uses lots of different techniques versus a process-based therapist. If you know what it is that you're trying to train the client to do, you may use wildly different techniques that don't look formally like they should be related.
Right. Yep.
So, I'm going to get reported for this, but it's not uncommon for me. So, I have a number of clients right now who I'm doing trauma processing work with. It's not uncommon for me to use like a traditional CPT ABC worksheet.
Absolutely. Yeah.
And then pivot towards, doing some diffusion techniques. Okay. So like you notice this thought comes up in this particular situation. And I like to use the sort of the framework of source of influence. Like how big of a source of influence does this thought based on your history need to be when you're trying to consider what's most important to you for you to do in this situation?
Yeah. Yeah. And so here, and kind of taking that to the next level and really thinking about ACT in that process, where I really started embracing kind of this idea of values-based work in ACT was when I started working with my OCD patients. Because they are so fused with whatever thought comes into their mind, right? That is their reality. And how do they learn to trust and kind of live their life in a way that is not OCD based? And that's really where we would do start with values based work, right? Thinking about what is important to them, what is the life that they want to lead, because they can get away from that and they can describe that sort of thing. And then that becomes how they kind of, when they have an OCD thought, they can ask themselves, right? To what degree is this like consistent with the value or the life that I want to lead versus not, right? So it gives them something to kind of anchor themselves when they feel like the only way they can function is to adhere to the thoughts that come to their mind. But that was a big shift for me, I think, in the concept of values-based work.
I think that's in some ways kind of what I was trying to get at when I was, I guess, trying to distill down these things a little earlier, is that at least from some of my very strictly CBT training, it had almost like thoughts have this determination kind of effect. Like, the thoughts are gonna, I mean, they're part of course, several different things that influence somebody's experience, their emotions and their behaviors and things like that. But if we can get in there and we can adjust thoughts, then we're adjusting experience. Like the thoughts themselves have this direct impact on their experience. And it's really that, as you were just saying that's the difference. There's kind of that one extra step beyond that of, okay, what does this mean? How much do I identify with that? And how much can I separate the thought from who I am, that diffusion? And I mean, like, to be fair too, when I was first trying to learn ACT and figure out what it means and how is this different than what I've always done before. And my first impression was, ACT says, okay, that's great, but what your mind is saying doesn't matter. Just do what works for you anyway. Yeah. And of course it's not that, right? It's not that what your mind is saying doesn't matter. There's a lot of interesting things that can come from, being curious and exploring that and being able to recognize the difference. And like you said, externalizing and like Russ Harris says, not getting hooked by that and dragged all over the place, but being able to kind of think about, well, how do I respond when that thought comes up? And, is that really what I want to do? Whereas with kind of the traditional CBT training that I received, it was kind of like, once you've gotten to the thought, man, you're there. Just change the thought. Everything's good. Yeah.
Right. But I really like that functional piece, right? Like you were saying, I think earlier, Andy, it's like, where does this take me? Right. Where do I end up if I engage with this either thought or this behavior or whatever it is? Where do I end up? And then is that where I want to be? Right? Is that the place that I want to, where I want to go? So I think it's like, can you experience and start to make that connection early in the process, right? Rather than, you've already gotten 16 steps into this sort of thing, right? And so you start to see, it's like, I know where this is taking me, right? And that's not what, even though there's an urge for me to want to go there, like that's not where I want to be. And getting them to a place where they can even be able to acknowledge and acknowledge that.
Absolutely. Yeah. How can our clients use their mind as a tool for their benefit rather than something that they need to fight or struggle with? And Kevin, I think your point is a really important one. It's not that thoughts don't ever matter, and this is even more important when you're working with. I think trauma survivors. And maybe even in
right, like and even contamination OCD, right.
It's not that there is no, like with OCD, it's not that there is no risk and that you there is
absolutely
just, and somebody who has had a difficult experiences in the past, or even if they were just in a military setting, the things that their mind is telling them to do, rules to follow, ways to cope, it's not like those are
irrelevant.
In fact, they might have been exactly the right things to do based on the past, the context they were in before. It's more as like, are these particular thoughts, even if there's truth to them, are they the most important, useful sources of influence right now?
Right.
And so exactly the discussion we're having today is maybe one of the things that whether you're a traditional cognitive behavior therapist, an ACT therapist, or really any other therapist, when we're dealing with difficult thoughts is, a primary thing that you want to try to be doing one way or another for your clients is helping them to really make experientially a distinction between them, the thinker, and the thoughts that they're having.
Yeah, right. That's that. I really like that idea, and especially to your point, Kevin, it's like, we can't just be like, that thought is unimportant, right? It's like we dismiss stuff all over the place, and it's like not everything can be dismissed, right? And then the question is, well, how do we determine? How do we make a distinction, right, between what we pay attention to and what we don't pay attention to? And that's where I think that more formal, like spending some time thinking about what is important to us, right? Almost having some philosophical discussions with your patient about like what is, and kind of going back to I was listening to your podcast earlier about religion and spirituality, right? Like, let's talk about these things that really are at the center of your life and what's important to you, and then how do these techniques help you do that better?
such a really, like, I don't know, I got to say that this is a great discussion because there's a lot of practicality and there's a lot of kind of high thinking too going on here too. I'm very, my brain's very activated. So I really appreciate the discussion.
This gets me
lots
super
of mental
like
events.
Well, yeah,
this gets me really excited about therapy.
I mean, so like, we could keep going and we could make it season 4, like we said earlier, because man, there's so much that's related to this. And I'm geeking out about it. I also recognize that, our listeners don't necessarily have 5 hours to, give to one episode. So I'm wondering if, it feels like we're kind of in a good place for today. And certainly I know we've said this to other guests too. And Jeff, you're our first repeat guest, but perhaps we can have you come back on again in a future season and we can talk more about this or related things. I mean, it's so fascinating to think about thinking. I mean, I don't think we do enough of that as therapists with other therapists to think about what, like kind of make explicit what's implicit and even, how are we approaching thinking about thinking? But so as we're kind of wrapping up though, Jeff, what we always do is we ask our guests for like a couple of pieces of actionable intel, something that listeners can go do right after listening to this or apply to their work or, something else they can pursue. I don't know whether that's other training or other resources or whatever, but do you have a couple of thoughts for us, a couple of ideas about actionable intel?
I really think one, even what Andy, you were talking about earlier, is really starting to shift a little bit away from a technique-based to a process-based sort of thing, right? Thinking like my supervisor says, process versus content, right? Thinking about the processes that the patient is going to, and that the content is simply a representation, right, of those sorts of things. And if we're always just focused on the content, like that's a whack-a-mole, right? And I think also actually getting training in maybe things that diverge from your traditional, because I think the more, and this is kind of the thing that like I take from my computer science days. It's like I learned my first programming language, right? And I was like, cool, I understand programming.
Right.
But then when I learned another programming language, I was like, oh, I am seeing these same concepts implemented in different ways, right? And when I learned Spanish, I learned way more about the English language and how to construct a sentence and, and what things are. So I think this idea of allowing yourselves to kind of be and explore multiple theories and really trying to understand, like in many ways, it's just semantics, right? That we're in a lot of this stuff and starting to see these connections between the different theoretical orientations, even psychodynamic, right? I think there is a lot of connection between from the past into the future. And if we can get past the language, because I think we get too, and this is where I was talking earlier, from the concrete to the abstract, right? Recognizing that ACT and CBT and even psychoanalysis, they do the best they can, right, to come up with language that is accurate. But at the end of the day, it's a simile, right? It's a metaphor for like this process that we're trying to describe. So I think being able to start to see that as a therapist becomes really important.
So don't get locked in an echo chamber of one particular orientation.
Well, I'll just add one little caveat to that, Jeff. And I would say it's a really good time in the history of psychology / mental health work to be someone interested in process-based therapy, because there is now a field that is dedicated to scientifically examining and determining what are some of the most important processes. So I would say, if you're interested in your a therapist who's interested in evidence-based psychotherapy, I'd highly encourage you to look into process-based CBT. And also, if you are
and I feel like something like the unified protocols could be another one as well too. Like I know there's trainings on that one that came out of kind of Barlow's lab, which is like it does some exposure therapy and it does some it's a little bit.
That's also another podcast. I have to say, I'm coming from the perspective. I own it. The perspective. I'm a functional contextualist.
Yep.
I would say and this is not a criticism, but one difference of the unified protocol is that it is more technically eclectic, and I would argue probably not as tied to processes.
Yeah, I agree with. I like that idea. What you're saying is focus on the process and the process-based CBT,
especially the ones that have evidence for them.
Yes. Well, I would love to come back. Maybe sometime we can talk more specifically about some of the evidence and process-based CBT.
Yeah.
Sounds great.
That sounds like a future episode.
Yeah.
All right, everybody. Well, thank you so much for joining us for the longest episode of the season. We wanted to leave you with some extra material to chew on in the interim before we come back with season 4.
Yeah.
Also, thanks for listening for our third season. It's been really
and thanks you guys for having me. I really appreciate the opportunity to kind of dig into this stuff.
Yeah, great having you.
Yeah,
I will say we talk a lot, of course, right? We've got 3 seasons of talking at you all. And so listeners, we want to hear from you too. Like, we imagine you all are thinking about what these topics have been, or have questions, or even have thoughts about topics we can talk about, people we can talk to. Like, what's on your mind? Send us a voicemail. We've set up a new a tool. It's called SpeakPipe. Actually, we didn't set up the SpeakPipe, but we have a SpeakPipe. So if you want to leave us a voicemail, like to, give us some feedback, ask us some questions, give us some topic ideas that you'd like to hear about, go to speakpipe.com/CDPP4P. That's all together after the slash. It stands for Center for Deployment Psychology, Practical for Your Practice. So speakpipe.com/CDPP4P. And we'd love to feature you in an upcoming episode in season 4 or beyond. So come talk to us. We'd love to hear from you. Thanks, everybody.
Thanks for listening to Practical for Your Practice.
Please feel free to subscribe, rate, and join in on the conversation in the comments.
Until next time.